Good evening and welcome to the February 5th, 2024 Grafton Board of Health meeting. Pursuant to Chapter 20 of the Acts of 2021, this meeting of the Grafton Board of Health is being conducted with both in-person and remote participation by board members and members of the public. Remote participation by the public, any matter for which the board allows public participation, will be via the Zoom raise hand feature. If you raise your hand on Zoom, you'll be enabled at an appropriate point to enter the meeting via voice or video to make comment or ask a question. In all cases, whether in person or remote, please identify yourself by name and address for the record.
This meeting is being recorded.
It is. Every vote will be taken by roll call. Please note that this meeting is being recorded. As a preliminary matter, this is Jen Maynard, Vice Chair of the Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Karen Gostalzi-Govin.
Here.
I really did it because we were talking about it. Dan Finn.
Dan Finn here.
Austin Magnet.
Austin Magnet's present.
Bill Mueller, I think, is joining us soon. Staff and anticipated speakers on the agenda. When I call your name, please respond in the affirmative. Nancy Connors.
Nancy Connors here.
Beth Caldera.
No.
Amelia Houghton. Karina Scott.
Karina Scott here.
Yes. Ian Wong.
Here.
Devon Thornton.
Here.
Thank you. Gina DePergola Tadeo. Emma Stefanski. Soleil Dennis. And Sarah Harris.
Okay.
Madam Chair, can I say one thing?
Sure.
As you can see, Sarah's here and she'll be taking Amelia's place.
Oh, yes. She
Okay.
might moonlight
So-
with us once in a while, she said. Welcome,
Yeah.
Sarah.
So she'll be in. Jen's here too from the DPH staff.
Yes.
Okay, but Sarah will be here instead of Amelia.
Okay.
All right. All right, I'd like to open the meeting. Can I get a motion to open the meeting?
Yep, this is Dan Finn. I'd like to make a motion to open this meeting.
This is Austin Magnet. I will second that motion to open the meeting.
All in favor?
Dan Finn, aye.
Austin Magnet, aye.
Karen Gostowski-Govin, aye.
Jen Maynard, aye. All right. Well, before we get to our usual and customary Alliance updates, as you mentioned, Ian, we have Jennifer here with us. Jennifer, can you say your last name for us again so we try and get it right?
I heard you earlier.
Ah,
Nachijova.
Nakajova.
Nakajova.
Yeah.
Okay.
Yeah.
So we have a recommendation on the table we have a item here to recommend to the select board to nominate you as the Chief of Community Health, Worcester Department of Public Health, Central Mass Regional Public Health Alliance, as the alternate ex officio non-voting member to the Tufts IBC.
And this is Dan Finn. I'd like to make a motion to that effect that we as a board recommend to the select board that they nominate Jennifer Nakajova as the alternate ex officio non-voting member to the Tufts IBC.
This is Austin Magnet. I will second that nomination.
Roll call.
Dan Finn, aye.
Austin Magnet, aye.
Karen Gostowski-Govin, aye.
Jen Maynard, aye. Passes unanimously. Congratulations.
You got
It's a short title, very short title.
one more step though.
One more step to get. You've passed the first one. All right. With that, we'll head on down to our colleagues at the Alliance to give updates and inspections.
Okay, I didn't think I would be so early. All right. So since the last meeting, we've had 13 food inspections and 1 body art establishment inspection, and a couple of complaints that were addressed. I think we may have talked about one. It was some raw. So it was when I think it was a pretty bad rain. And there was also a complaint about food poisoning. We couldn't determine that it was food poisoning. And I know the nuisance complained about some wax burning candles in an apartment that was having an effect on one of the tenants. And we have also had 3 Title V inspections done since the last meeting. And I just would like to really thank Nancy and Beth for all the help they've provided for me thus far since I've started working with the Alliance. I really appreciate it.
Thank you. They are a great
Thank you.
resource for all of us. Board members, any questions for Devon?
Yep, hi Devon, this is Dan.
How
I
you
had
doing,
one
Dan?
question, but Austin enlightened me. And that was whether at the address of the raw sewage, if that was a business or a residence, and he thinks, and it's probably true, that SF stands for single family. Is that correct?
The single family, yes.
Okay. And then I guess the only other question I had is that it's nice Brian helped with that particular investigation. So is he available to you and to us on occasion to do that? To follow up on some complaints?
I actually think I think he would be. I think Brian was there before me.
Yeah.
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 Okay. But you did visit it, or?
Yes, yes, I did.
Great.
Yes.
Thank you.
Anything else? Great. Thank you.
You're welcome.
Any COVID-19 related updates or other Alliance updates?
Sarah, do you want to give an update on nursing?
Sure. I just knew I was going to wait for Ian to introduce me. I didn't know what time it was coming.
We're here.
Surprise. Thank you for having me. So like you said, I'm Sarah. I'm the newish deputy chief of public health nursing for the Alliance Towns in Worcester. So for vaccinations, the second round of shingles vaccines were given out at the senior center in the month of January. And there were also some RSV vaccines also distributed. With reference to respiratory illnesses, just like the rest of Massachusetts, there has been a slight increase with both COVID cases and flu cases, but very, very slight increase, less than the average in Massachusetts. But we are still continuing to educate people on safe practices, hand hygiene, safe space distances, and answering calls daily, weekly, whenever we bump into people, whoever bumps into people, and still giving our opinions, obviously, to those who reach out. In reference to foodborne illnesses, nothing clinically diagnosed, but as Devon referenced, there was somebody who called in and did make a food complaint that he went out and investigated. In reference to blood pressure clinics, they're continuing at both the senior center and the housing authority. And added to the blood pressure clinics, they've added in this month of January, I'm not sure if it was talked about last month for starting this month, but they did start the File of Life for the seniors, which is a convenient way to keep everyone's medical information, like their medications, allergies, past medical histories, all in one place. So I don't know if you guys, I should have had a visual. I do apologize for next meeting. Maybe I'll try really hard to remember. But Karina was able to get a whole bunch of File of Life magnets. So they're a big red magnet that sticks on the fridge, and they have a piece of paper that folds out. It does recommend being filled out in pencil. So the nurse will help fill those out at the blood pressure clinics for anybody who needs them. So those started this month, and they'll continue here on out. And the monthly health topic this month was behavioral health. And that's all I've got, unless there's any questions.
Questions for Sarah? Welcome, Sarah. We should have said that when we were hanging out with you before the meeting started, but welcome again.
Thank you. Thank you.
Sure. All right. We've been joined by Bill in the room here.
Sorry, I was late.
That's all right. Welcome. You made it just in time for almost our favorite part of the meeting, which is to gonna vote on a lot of minutes. But before that, do you and Dan want to give any updates on opioid settlement funds? I think you had a meeting after we met last time, maybe? Maybe.
Yes. Well, we do have a follow-up meeting scheduled for the 20th. I've invited one of my former colleagues who has special experience in this. She used to work at a community health center in Worcester, and as part of that was working with students who had developed substance abuse problems who were at a special high school in Worcester. And she's a internal medicine pediatric specialist, and she's agreed to come to our meeting on the 20th.
Great.
And I think she's had some contact with other municipalities. In the Globe today, there was an article saying that 90% of communities have not spent any of the money that they got out of the settlement.
Wow.
It's on the front page. So we don't, I think, have to feel too
Pressured.
badly about the fact that we haven't really made more progress on this. But I do think Margaret's perspective on it will be helpful. We do have representation on the community, on the committee by a number of concerned entities, including the police and so forth. It had been suggested that we may want to reach out to some parent who had had a child who had had this sort of thing to struggle with. And I think we may choose to do that if the committee wants to do it.
Sure. Great. And if we don't spend the money, there's not like a timeline, right? It just sits there and waits until disbursement. Is that right?
No, and I think actually the money is really due to be dispersed over a number of years.
Sure. Yeah.
And so if we haven't spent it, it just rolls over.
Okay.
I mean, I think one of the challenges is it's not a huge amount of money.
Right. Right.
And so one of the things we've talked about, just from a philosophic standpoint, is perhaps try to augment something which is already an established program.
Yeah.
And so we've been learning something about what programs there are.
Yeah, exactly.
And hopefully we'll have something more definitive to kind of report on.
Great.
So is that Dan's going to fill in all the
Just one other thing that we've also invited Dr. Stephen Tosi to come to the next meeting, and he's going to try to juggle the schedule. He's been a resident of Grafton for a very long time, and he's been affiliated with UMass in a leadership position as well. He's a urologist as well, and he's semi-retired, but he also is currently in the administration, and has expressed an interest and can help us figure out some of the existing avenues of support. And I'm thinking not only for the folks that are involved with the addiction and with the disease, but also with the parents and the grandparents, and some support for those folks. I'm wondering if that's out there in terms of counseling, because there's a lot of grief, obviously, with that comes along with this. So he's hoping to make that meeting as well on the 20th.
Great.
We had also reached a decision not to join the consortium that's in the Blackstone Valley. And some of that was based upon the observation by our police chief that almost all of the emergencies go to Worcester. And that program in the Blackstone Valley was very much oriented towards Milford.
Okay.
I think we spoke about that at the last meeting, or
Right.
one of the last meetings.
Yeah. And folks in Grafton could kind of go in either direction, right?
Right, but I do think they more frequently go north than south.
Yeah.
And, excuse me, this is Dan, but Karina, do you have anything
Yes.
to add?
She's been patiently waiting with her
Yeah.
hand raised.
I have been. I've been good about it. Good evening. My name is Karina Scott, and there's just a couple more things, an update. So I think you are right. 90% of the communities have not utilized the funding. I think some of the challenge that a lot of communities are having are engagement of the community aspect of the funding that is somewhat required on and how to, how did we come up to this decision? How did the subcommittee come up with the decision to fund certain things? They want to see community involvement, some thought behind it. So I think I gotta say, like, for the fourth, I think we're gonna meet on the 20th, and I just sent out the invitation for that meeting. Yeah, I think for the fourth meeting, we've done a lot of good work and talking about the situation, figuring out what is happening in Grafton and where should the resources be going to help the residents. One of the things that we talked about in last meeting is how do we get the community voice? A survey came about, creating a quick survey, kind of asking folks about their thoughts, if they struggled, if they know someone that struggles, and also part of the survey is inviting them to be part of the subcommittee. Another thought was to publish it in some kind of community forum or newspaper to kind of get more light of what's happening. I think there's a lot of good work happening in the subcommittee, and I don't think the residents are aware. So one thought was to disseminate the survey at a training. So one of the things that we've been working on is really setting a date on a Narcan community training, and then having folks that go in there complete the survey, and see how we get a good turnout there. I have an intern working on a mock-up flyer for you guys to approve soon, so you guys will see that, and a survey for you guys to comment on it and alter the questions if you want to. But I think I'm really excited with the work that the subcommittee is doing, and I'm excited to be helping them in any capacity if I can. And I also have more updates for the Lionstown too, once we're done talking about the opioids.
Great. I think just for the survey, to your point, Karina, I think it's great to try and engage people at a specific event, but certainly I think we probably need to try and, post on our website, post on social media, because really that's where we're going to get from people that might not necessarily be accessing these services. And I think, the part of the whole point of having sort of this subcommittee was to engage stakeholders that are already doing this work, but to your point, even broader, the community to really see what would benefit them most. So that's great to hear. I think that's the right step. It's not a rush to spend the money. It's the right path to find and make sure we're enhancing what's there, as Bill said. Great. What else for updates, Karina?
All right, I'll go next. So for February, the topic of the month, which is a little bit delayed, is going to be heart health. That's coming up soon. We're working on that right now. And let's see, that's happening. Last month was behavior health. And then what do we have? Yes. Sorry, I lost my notes for a minute. The other update I have for you guys is I'm losing my train of thought. I'm so sorry. It's gonna come back. Yeah, I can't. I lost it. I'm sorry. So it will be heart health for the month of February. That will be the topic of the month, and I'll ensure that that gets translated to multiple languages that we have in the community for easier access.
Great.
I think that's for now that I can remember. That's it.
If it comes back to you, just raise your hand. We'll call on you. We're here. Great.
And we understand.
Yeah. It's Monday. All right. Any other discussion items on Alliance updates, opioid settlement, anything else before I move on to minutes from anybody?
Jen, it's Nancy.
Hi, Nance.
Hi. So I don't know if I just missed it. So is this still considered a subcommittee of the Board of Health, or is this a committee on their own?
We're hard to define. I don't think it's a subcommittee of the Board of Health. I think it's a larger scope of the committee. So it certainly has representation of the Board of Health, and Karina has obviously been hugely helpful to us in terms of organizing it. So I would think that it's actually a ad hoc committee.
Yeah, members of the Board of Health sitting on a community-based committee.
Right.
Okay. Thank you.
Great. All right. We have a large list of minutes. Hopefully folks had an opportunity to review and you know your dates that you can vote on. So I'm just going to go through in our usual and, you guys will make your motions as you talked about.
Jen, it's
Yep.
Karen. It looks Karina had her hand back up
Oh,
again.
sorry. Go ahead, Karina.
Just before we get into the litany
Yes.
of minutes.
The thought came back. So one thing that I've been thinking about is, and I think with the conversation of how the subcommittee is so hard to define, and how we hope to engage the community in a larger scale, it could be a thought to renaming the committee, and maybe in a more broader scale of like a wellness committee or something, where any of these subjects come about, that's health related, it can be discussed in a community setting type way. When we had when COVID hit, that could be something that you guys could meet and talk about what's going on with COVID, or if there's any situation health wise, if it's something going on with the behavioral health. So just a thought. I know that there are wellness committees at the public schools, but I'm not sure if they've been able to meet due to capacity issues. So this could also be replacing that too, with a broader scale, inviting the schools as well. So just a thought to put that out there, since this committee is a bit harder to define, but if we get the community engagement, it could be a really good momentum to really have broader engagement in terms of health and wellness and prevention.
Might be a good thought to bring back to the committee, to kind of talk through if they would like to be engaged more. I mean, obviously they have a lot of access to the public that more than we probably do, as a thought, and then we could talk about, rotating people around or something like that if there's appetite for that. Okay. Thanks, Karina. All right, somebody flag for me if her hand goes up or anybody else's hand goes up, because I'm going to be laser focused on these minutes. All right. For the January 8th, 2024, do we have a motion to accept the meeting minutes as presented?
Yes, this is Dan Finn. I'm going to jump in for the first half dozen here. And I would like to make a motion to accept the minutes of the Board of Health January 8th meeting 2024.
I'll second that.
Roll call.
Dan Finn, aye.
Bill Muller, aye.
I was not there, so I will recuse myself.
I was not there either, so I'll recuse myself.
Jen Maynard, aye. Passed by the skin of our teeth. Let's see, the November 6th, 2023 revised minutes.
Yep. This is Dan. I'd like to make a motion to accept the minutes of the Board of Health's November 6th, 2023 revised minutes as presented, as revised.
This is Bill Muller. I second that.
This is Austin Magnan. Aye.
Aye.
Aye, aye, aye.
Gentlemen, aye.
This is Bill Muller, aye.
Dan Finn, aye.
Karen Gustowski Govan, aye.
Jen Maynard, aye. October 1st, 2019, joint meeting with the Select Board.
This is Dan. I'd like to make a motion to accept the October 1st, 2019 joint meeting with the Select Board and the Board of Health as presented.
I think I abstained because I don't.
Yeah.
Okay, yeah, this is Austin Magnan. I will second that motion to accept the October 1st, 2019 joint meeting with the Select Board meeting minutes.
Roll call.
Dan Finn, aye.
Austin Magnan, aye.
Karen Gustowski Govan, aye.
Bill and Jen abstain. October 1st, 2019, joint meeting with the Finance Committee.
This is Dan. I'd like to make a motion to accept the October 1st, 2019 joint meeting with the Finance Committee.
This is Austin Magnet. I will second that motion to accept the meeting minutes from the October 1st, 2019 joint meeting with the Finance Committee.
Roll call.
Dan Finn, aye.
Austin Magnet, aye.
Karen Gwiazdowski, Govin, aye.
Bill Muller abstain.
Jen Maynard abstain. February 10th, 2020.
This is Dan. I'd like to make a motion to accept the minutes of February 10th, 2020 of the Board of Health.
This is Austin Magnet. I will second that motion to accept the February 10th, 2020 meeting minutes.
Roll call.
Dan Finn, aye.
Austin Magnet, aye.
Karen Gwiazdowski, Govin, aye.
Bill Muller abstain.
Jen Maynard abstain. June 8th, 2020.
This is Dan. I'd like to make a motion to accept the minutes of June 8th, 2020 for the Board of Health.
I have to abstain because I was not there. I think Karen was the only other one there.
Yeah, we can't vote on it, right?
Yeah.
No.
Okay, hold.
So I'll withdraw that motion.
Withdrawn. Karen, how do we, Nancy, how do we handle that?
I was gonna say, I don't know if we've ever run into that situation. What do we do there?
Who was at that meeting?
Dan, Karen, and maybe Josh.
I think Josh.
Yeah. Pre our time, so must have been.
I'll let me check on that.
And I don't think Deb was there either. It was just the three of them, I believe. Debbie was a pre.
Oh, okay. Pre my time in Grafton. Okay, how about this one? I think it's your moment to shine, Bill. August 3rd, 2020. Maybe right around there. I'll take a motion for that. Anybody?
Oh, this is Austin Magnet. I will make a motion to accept the August 3rd, 2020 meeting minutes.
Bill Muller, I'll second that motion.
Thanks. Roll call.
Austin Magnet, aye.
Bill Muller, aye.
Dan Finn, aye.
Karen Gwiazdowski, Govin, aye.
Jen Maynard abstain. December 7th, 2020.
This is
I
Austin
didn't see
Magnet.
that one come through. This is Karen.
Oh, you didn't see the minutes?
No.
I thought I saw both Decembers.
Nancy, do you know if you sent that one?
Let me get on here.
There were so many of them and they all
I
started to
know.
blend in. So don't quote me on that. But I jotted down, I didn't see it come through, but I could have missed it.
Uh,
12/28.
no.
Yeah, it was
No,
in the.
12/28 is in there. I'm trying
Yeah.
to find 12/7 actually now. 12/28 is from 1/27/24.
Well, 2820 is there.
Great.
Yeah.
So we'll pass on the 7th again.
I don't see December 7th.
Yeah, I don't see the 7th either.
Okay, so we'll hold off on the 7th. We're gonna
Okay, I'll check on that.
skip down. Good catch, Karen. December 28th, 2020.
This is Austin Magnet. I will make a motion to accept the December 8th,
20.
December 28th, 2020 meeting minutes.
This is Dan Finn. I'll second that motion.
Roll call.
Austin Magnet, aye.
Dan Finn, aye.
Bill Muller, aye.
Karen Gwiazdowski, Govin, aye.
Jen Maynard abstain. Let's see. July 12th, 2021 is a meeting that ended up canceled. But we have minutes to reflect such cancellation.
Yeah, some of these I was like, okay, hold on, let me. Oh, it was just a cancellation.
Yeah.
It's just a cancellation.
That was easy.
Yes, it's
I
an
think
easy
these
one.
Last three, but this is Austin Magnet. I will make a motion to accept the July 12th, 2021 cancellation meeting minutes.
Second.
Dan Finn, aye.
Bill Muller, aye.
Second.
Roll call.
Austin Magnet, aye.
Dan Finn, aye.
Bill Muller, aye.
Jen Maynard,
Karen
aye. It was
Gwiazdowski, Govin,
official
aye.
there. Karen. That was supposed to be my first meeting, actually. All right. August 13th, 2018. Is that the one that you said that you were not there for there? That Austin?
No, it was the June 8th one.
Oh, okay.
I think this
All right.
one was canceled as well.
August 13th.
Yeah, I'm trying to find it real quick.
I didn't jot down notes on cancellation none. I just jotted down like who was on the board, who wasn't at the meeting.
There it is,
Try to keep
8:13.
things straight.
Yeah, the meeting was canceled due to lack of quorum on August 13th.
Oh, yeah, I have no quorum really written right here, actually. You'd think I would have realized what that note was about. All right, so we had a canceled meeting due to no quorum. So those of you that were on the board, I suppose, can vote on that. August 13th, 2018.
So this is Austin Magnet. I will make a motion to accept the August 13th, 2018 meeting minutes.
Dan Finn, I'll second that.
Roll call.
Austin Magnet, aye.
Dan Finn, aye.
Bill
Karen
Muller
Wistowski,
abstained.
Dove and I.
And Bill Muller abstain, and Jen Maynard abstain. And finally, August 4th, 2020.
This was the same thing. It says Board of Health had no quorum. It was a select board meeting.
No quorum. Okay.
But again, we do have minutes here. So this is Austin Magnet. I will make a motion to accept the August 4th, 2020 meeting minutes.
Second.
Dan Finn, I'll second that motion.
Roll call.
Austin Magnet, aye.
Dan Finn, aye.
Karen
Bill
Wistowski,
Muller,
Dove and
aye.
I.
I think you were there then. And Karen, I, and Jen Maynard abstain. All right. We made it through them. Just a couple withholds or holds. Nancy, we are plugging away on those. Was it?
Yeah, December 7th, the meeting was canceled. So that will be on the next agenda.
Okay, perfect.
And a very easy one to write up
We love it.
Yeah.
and review.
Okay.
I don't think there was any mail or
I
anything.
didn't see any mail or miscellaneous, anything to flag here.
The only thing, I've sent everything off to you, but we had an email from Amelia, and it was about interest in long COVID ambassador training. I don't know if there's an update on that. It was back to January 22nd.
So they're volunteers.
Madam Chair, I can speak to that. So with the Boston University, they've been looking at long COVID and the trends, and they have a training set up to help staff and all that understand some of the impacts of long COVID on citizens in the Commonwealth. And so there, I can't remember the date off the top of my head. It's just talking. I don't know if you know, Sarah, off the date of when we're having, but I can send it to you. So it's an in-person training. Yeah, go ahead, Sarah.
I believe she's aiming for mid-March. I heard her trying to book the room as I was leaving this evening. So about mid-March. I don't want to say the exact date just in case.
Yeah, because I was at a meeting with her today where we're talking about, so I mean, it's one of those two things. We're trying to pick a date and see what the number of people are, and we all know how that goes, trying to, arrange dates and people coming. But it's a train from BU. There's also, for those who attend, also get a gift card for attending. It'll be at the 25 Mead in Grafton, in Worcester at the Board of Health. And I can send you, or at the Health Department, Division of Health, and I can send you more information about what the training is. I think it's from, I want to say 10 to 2, so like a 4-hour training or so during the day. And BU, I think it's a medical school, or the BU School of Public Health has trainers who will come in and teach people about the impacts of long COVID. And then what the plan is to help them go into the community and work with people in the community who have long COVID. And I think this will be the second cohort that they're doing this on, and they chose out here. And so again, I'll send you information since I talk to Amelia tomorrow.
Great. Anything else?
Jen, I have one thing. Nancy, I'm thinking if we want to, and actually the whole board, we should, if we want to host the rabies vaccination clinic. And it's probably not too early to get in touch with the Tufts Veterinary School. And I'll be happy to do
Tufts
that.
will be contacting me next week.
Oh, okay, good.
We have it on the calendar already.
Great. I know last year, I think we did it on April 1st. And I don't think it matters too much, whatever's convenient for them on a Saturday morning. But that's good that you're following up on that.
Yeah, it's great.
Thanks.
Good offering.
I believe we're looking at, where's my calendar? We're looking at April 6th.
Great.
Yep,
Okay, let me know if I can help in that regard. It was pretty successful last year.
absolutely.
You know, and I think it was great for the students as well. There were a couple of professors and probably 10 or 12 students, and it was a very good learning experience for them too. So.
Like my cat had perfect
I was
time
just
to
your
show
cat
up.
joined right in time. The cat's like,
Perfect time.
what, vet?
You talking to me?
I don't need no stinking vaccine.
Free
The
shots.
cat says, I'm not going to the vet. That's cute.
He knows Tufts, but yeah.
All right. Great. Thanks, Dan. Anything else? All right. We have all of our meetings scheduled through July 1st at this point, so that's probably good for now.
So the next one is a hybrid right here.
March 4th will be hybrid again.
Okay.
And we decided on a little bit more remote through the summer months, just knowing people might be away and things like that. So, all right. If that's it,
I'd like to make a motion to adjourn this meeting.
second
This is Austin Magnan. I will second that motion to adjourn the meeting.
roll call.
Dan Finn, aye.
Austin Magnan, aye.
Bill Muller, aye.
Aaron Gwiazdowski, Govan, I.
Jen Maynard, aye. All right. Thanks, everyone. Have a great rest of your Monday evening.
Yep.
We'll see you next month.
Thanks.
Thank you, everybody.
Good night.